Like most doctors, I began my career by swearing my allegiance to the Hippocratic Oath. As a pediatrician, I was so proud to be part of the tradition of the ancient doctors who swore, in the same spirit as we do today, to treat the sick and protect them from injustice, and above all, to first do no harm. Since the times of Hippocrates, medicine has evolved in unimaginable ways. Inside our clinics, we've become brilliant at treating our patients' symptoms. But outside our walls, some of these illnesses are growing to epidemic proportions. Of course, we ask ourselves, what is making people sick in the first place? And why do they keep coming back? In our journey to diagnose and treat the body, we've been to the moon and back many times over, masters and explorers of the very small. But 20 years ago, some of us saw that to understand the problem, we had to take a wider view. From that vantage point, we saw thermometers, each containing enough mercury to poison an entire lake, piled up in our trash. From an even wider lens, we saw medical waste incinerators on our own properties throwing toxic fumes skyward. Dioxins and mercury from waste incineration fell to Earth, entering the water we drink and the fish and animals we eat, poisoning our bodies and the developing brains of our children. Our own fingerprints were all over the scene. We were contributing to making our own patients sick, all in direct violation of the oath we had sworn to do no harm. So we formed a coalition of doctors, nurses, and advocates to push back, and pushed healthcare to stand with our oath and clean up our own house. Today, only a handful of incinerators exist in the US, and mercury thermometers are going the way of the horse and buggy all around the world. But while you listen to me, the climate is changing, and the people we serve face perhaps the biggest harm of all. Now we need healthcare to be a leader within this widest scope. Look at healthcare's global footprint. We consume huge amounts of energy on every continent, contributing to climate change and air pollution that kills 7 million people a year. In the US alone, healthcare is responsible for 8% of greenhouse gas emissions. But here's our leverage. We are 18% of the US economy and 10% of the entire global economy. The changes we make really can move entire industries away from harm and set new norms that will positively impact our patients' health. Imagine, for instance, if healthcare fought antibiotic resistance by purchasing only antibiotic-free meat. Or how innovative solutions to eliminating waste, like biodigestion, could help power hospitals and reduce air pollution around the world. Healthcare could help make renewable energy viable. By choosing to turn away from fossil fuel, we would reduce the carbon emissions that harm our patients and our planet. We stand at a turning point in the course of medical history, and we can move to a tipping point. It's within our power and our mission. Dr. Martin Luther King said the moral arc of the universe bends toward justice. Join us as healthcare bends toward a more just and sustainable future, rooted in our original oath: do no harm.